Father, let me start with you. Well, numbers are up always. We wouldn't have you here if it weren't for that. I mean, you're always are invited here to discuss the numbers, of course. But I also wanted to start with, government is becoming much more explicit with this paradigm shift. No? Let's stop talking about ECQ. Let's stop talking about community quarantine. And in the past few days, they've been very explicit na granular lockdowns na pinag-uusapan natin ngayon. Granular lockdowns na. And that shifts really the conversation from IATF decisions to LGUs and so on. I'm just wondering, given the numbers that we've been seeing the past few days, does the timing make sense for this paradigm shift, or is this just as good a time as any to try something new?
Well, I mean, I just finished calculating the vaccination protection rates for the hospitals of the NCR. And it's clear that the vaccinations are protecting our people. So in terms of hospitalizations, let me just look at that data, which I just calculated for OCTA about 15 minutes ago. So if you look at hospitalized COVID-19 patients, the vaccinations have decreased the risk by 2.125-fold. And for severe and critical COVID-19 patients, the vaccines in the NCR have decreased the risk 3.75-fold. What this means is that you're seeing significant protection. We're trying to identify the data from other countries, especially Singapore, Iceland, and the United States, that have varying levels of vaccination, to see how those numbers compare with other countries. Nonetheless, what you're beginning to see is that there is an effect of the vaccinations. And so if we are going to move away from hard lockdowns, this is the time that we would be able to consider it, because a month or so ago, we would not have had this kind of population immunity that we're beginning to see. And I know that based on the numbers that I received earlier today, the NCR should be fully, 50% of the adult population should be vaccinated by the end of about 2 weeks from now in the NCR. So as we increase the vaccination rate, we hope we will see decoupling more significantly. I'm trying to calculate that number. We do not have that data readily accessible in the Philippines to do these numbers. But if we are going to talk about moving away from hard lockdowns, the vaccinations are allowing us to even consider that. And I'm going to hand it over to Professor Guido David, because I have not looked at today's numbers yet. I just woke up here in the US. So he has a better sense of the immediate context for the pandemic in the NCR.